So that is the area of your knee. And if you go below, you are going towards your groin area. Okay, understand that? Now, let's look at the back of your hand now. Now we understand, because these are the right side and left side. I am emphasizing over and over again because this is very important. If you are having any issue with your shoulder, with your rotating cuff, those are the main issues that a lot of people are complaining about, and those are the areas that we must find out effectively and right away. Because I said this area is your atlas, C1. And next joint right here is your C7. And which means right in between C1 and C7 is what? C4. Do you get it? So what I want you to do is, for anyone and everyone who has issue with your neck, shoulder, lower back, or whatever, first thing that I want you to check is your C1 to C7. Either yours or someone else's. Hold the locator, energized locator, just like a pencil. Put your hand down on a surface, or if you're actually helping other people, hold their hand with your left hand and hold the locator with your right, and then press firmly, pressure up 3 or 4 on C1, C2, C3, C4, C5, C6, and C7. How do we know? Like I said, C1 is right at this point, correct? C7 is right at this point, correct? And C4 is right in between. Chances are people will say, owie! Either one or more areas that you're pressing. Did you find that point? Painful point?
Oh yeah.
Oh yeah. People will find those points.
Mine's right on C7.
Okay, very good. You do not have to ask yourself why. Just go ahead and stimulate those areas. That's all you need to do. And miraculously, just by doing it, you can feel the difference within a minute or two.
And move the head and listen.
Yeah, just move your, yeah, exactly. Move your hand as you stimulate, because you can actually feel the difference. The range of motion, whole lot more. And also the tension, flexibility. Things get better right away. Now, here's another thing. Okay, this is C7 that we know. And as we go down lower, we're going down your spine, your cervical, thoracic, and also lumbar. Here is what I want you to do. Instead of working on thoracic part 1, T1, T2, T3, whatever, just I want you to follow with your fingertip all the way down the middle finger and find that little indentation that you feel at the bottom of your middle finger bone. Do you feel that right there? Now, that right there is your tailbone. Does that make sense to you? That right there, some people, when I touch their hands right over here, some people actually have longer tailbones than other people. But don't worry about it. Wherever the end is, that's the end of the person's tailbone. Now, here's another thing. From the tailbone area, I want you to go up about 1/4 of an inch and make a little point, like I do right now. Why? Because if you find a tailbone, go up about 1/4 of an inch and find that little point. Doesn't matter who you are, just go up about 1/4 of an inch, which is about this much. About that much. Why is that point very significant? Because that is your L5. That is your L5, your lumbar, lower lumbar. And then, utilizing this tip right over here of your energized locator, see that radius of that ball? I want you to put it right on that point and move exactly 1 ball radius above it. And that's your L4. Does that make sense to you? And from there, I want you to go up a little more, just 1 radius of that little ball at the tip. That's your L3. Does that make sense to you? So basically, press L5, L4, L3, But you have to be careful. Why? Because your tissue is moving. You could actually press L5, and if you move up the tissue, you can actually press L3. Does that make sense to you? So make sure that you lift off the locator and bring it down. Lift off the locator and bring it down. That's how we can go up to L1. Does that make sense to you? Let me show you one more time. L5, L4, L3, L2, and L1. So L1, I want you to make another point. So between L1 and C7, how many thoracic parts do we have? We have 12. What does that mean? That means between there, C7, and L1, you have 12 bones in between. So I want you to break it into half, approximately half, which will be somewhere around here. That's your T6. Exactly.
Okay, where's T6?
Right below the knuckle. Right below the knuckle. Right on opposite. Well, no, actually a little lower because it's on the back of the spine.
Okay.
So basically, these are the skills of measuring this part. But don't worry too much about it. Why? Because majority of the people are having issue with their neck and their lumbars. And even all these sciatica issues, it's pretty easy for us. Why? Because if you have checked all those lumbar areas, depends on where they have the pain. Let's say that the person has L3 point right there and having great issue with the pain and very sensitive. For his or hers lumbar or the sciatica point issue is all you need to do is from that point move to the sides, which means if you're looking at it right like this, if that person is having more pain on the right, go towards the right and press those areas. If that person is having a left sciatica issues, go to the left. Then sure enough, you're gonna find those points. And what do? Ask them to grab guardian angel. Instead of poking one by one, ask them to just roll it around randomly. Why? Because just if they are trying to pick that one point, it'll be difficult. With guardian angel, rolling it around, you are hitting more than 30, 40 points randomly on your sciatica. And that's why people, when you see all these testimonials that people are giving, they're saying, I had this back pain and I couldn't walk, and within 2-3 minutes. Because we are stimulating with the sharpness just like a needle on those locations. That's why I usually see, instead of doing this, holding one part and doing this, I usually ask them to put the whole thing and roll it around with the hand. That's much easier and you can cover much bigger areas. And if it's the right side, focus more on the right. If it's the left, focus more on the left. But here's another issue that everybody's saying. Well, you know what? That hand is very tender now. What does that mean? Go to the other hand. Okay? But I will show you exactly how to transfer that point. Let's go for another area here. Let's say that you are feeling pain around here, near your groin area. A lot of people will have those issues too. I had a gentleman who was having very hard time walking, getting out of the bed, standing up from the chair. He just could not because that muscle right there wasn't really working properly. And all I told him to do was finding that point around these groin areas on the sciatica, and then I asked them to squeeze and hold it for just a couple of minutes. And because that he has so long of the issue, it was one of those chronic ones because he had it for like 6 months. So I told him to do the front part as well. And within about 3 minutes, he was doing it like he never had the problem with. So it is much wiser choice to stimulate more regions than just pinpointing one only at the beginning of the practice. But once you get used to it, once you get really proficient with all these points and tools and everything, you can really get to that point very quickly.